So tell us a little bit about, let's start with interstitial cystitis and just let's define what that is.
Sure.
And then maybe some treatments.
Sure. So interstitial cystitis, or oftentimes called bladder or painful bladder syndrome, is characterized by bladder pain of variable severity, really, over a long period of time. It's more common in women. Usually happens in typically the 4th decade of life, but can happen a little bit earlier. Unknown etiology, so not exactly sure where it's coming from. Oftentimes, sometimes it can be due to a host of different reasons, which we'll get into in a little bit. But it is characterized by a lot of pain and discomfort, and patients usually will report to me having a lot of bladder sensitivity, pain with urination, even fatigue and depression due to how long this has been going on. Pain with sex is very common too, and can cost a lot of money. I think last time I read that there was like $65.9 million a year in healthcare cost, and so oftentimes these patients also see multiple different providers for IC. They go and go to different urologists, go to different pain specialists to try to identify what's been going on. A lot of tests come back negative for them, and so when they're doing urine cultures to see if it's a UTI, it comes back negative. When they do cystoscopies to look inside the bladder wall, it comes back negative. So very complex disease process, and unfortunately results in a lot of pain for people.
And so tell me about some of the treatments. Do you dive into what's causing it possibly instead of just treating symptoms, or how is the best, what's the best route to go?
Yeah, great question. So my job really is to be kind of the detective in all this and really try to identify what's going on. IC is oftentimes too a blanket diagnosis. You sometimes get that with IBS. It's like, oh, well, there's irritable bowel syndrome. We're not exactly sure what's going on. Has some diarrhea, some a little bit of constipation, a little bit of both. IC is similar in that aspect, is that it is oftentimes given presumptively or prematurely sometimes, and just because they don't know exactly what's going on. And so usually for the first little bit, we will dive in and talk about different aspects of health. So autoimmunity has a big part to play when it comes to bladder health. Dealing with chronic infections such as Lyme or EBV have an aspect that can also cause a lot of bladder issues as well. And then going into, if it is bacterial in nature. And what we're starting to find out more and more is when we do a little bit more advanced testing with these urine cultures, because your standard urine culture is okay. It's not the most sensitive and specific test, but when we look at more advanced urine cultures, we're able to identify certain microbes and pathogens that have been more embedded into the bladder wall, and that can be the cause of a lot of these symptoms. And we're starting to see that more and more. And so when it comes to treatment for embedded urinary tract infections, oftentimes, an oral antibiotic, a lot of times patients have been on a lot of different oral antibiotics. They've tried everything and nothing seems to work. They might be on it for 5 or 6 days and then, go off of it for a bit, might see some benefit, and then usually have a lot of GI issues if they've been doing it for too long. So when we identify which pathogen it is, usually due to the nature of embedded infections, what they do is they form what's called a biofilm over top of it. So your pathogens such as Klebsiella, Pseudomonas, are big biofilm disruptors, or biofilm producers, and so they trap themselves inside that bladder wall and can cause a lot of pain and irritation. Whereas E. coli and Enterococcus, they still do form. Those are definitely the more common microbes that you see in urinary tract infections. They still do form biofilms, but not as much. And so when it comes to treatment side of things, for the bacterial side of things, it usually is either a different herbal concoction, so whether it's uva ursi, corn silk, cranberry, we're using a lot of different herbs depending on which microbe shows up, whether it's gram positive, gram negative, determining the urine pH, gets into a lot of different things. But also we're using things such as bladder instillations, which are a compounded antibiotic formulation that you can insert through a catheter into the bladder wall and provide some relief, some direct kind of approach instead of going through the GI system and causing some dysbiosis into the GI tract. We're able to hit it hard where it's at. Now, oftentimes too, I'll include a EDTA, which is a biofilm disruptor, into my bladder irrigations to be able to kind of break up those biofilms. So that's one aspect of it. Also use sometimes a vaginal estrogen cream if we're dealing a lot with dyspareunia or painless sex or vaginal dryness. That can be a big cause to some of these IC-like symptoms, and it can provide a lot of relief. So compounded estriol cream, which I think you guys do very well, is a great treatment option for that, and can oftentimes be overlooked, especially with a lot of different providers, and can be an easy fix. So that's kind of a bulk or an overview of treatment, but there's definitely other aspects of it that you can get into too.
Yeah.